Hey everyone, welcome back to the channel. My name is Kelly Troutman. I am a certified hand therapist, and this is Forward Therapy. In today's video, I wanted to go over assessment of CMC or basal joint arthritis. So this is a question actually that I got through Instagram. Somebody out there wanted to kind of know about thumb arthritis treatment and hand therapy. So I thought, why not kind of go through a few different videos? We can make it like a little series of kind of going through some assessment, some treatment ideas, progression, all of those kinds of things. So hopefully you guys enjoy this video. If you have any ideas or for topics or things that you'd like to see in the future, or certainly any comments on the video or things that you think I missed, please leave them below. I would like this to be kind of, again, an open discussion for all of us to get involved in. And of course, this video is targeted more towards therapists, so it's not necessarily something that if you are not a hand therapist or at least a PT or an OT, you probably will want to go to a different video. So thank you for clicking on, but definitely a video that's targeted towards my therapist. So yeah, let's get into it. Today's video, we are going to be talking about assessment of the CMC joint. I think we've all been there, right? You get into your clinic for the day, you look up your patient cases, you see that you have a new patient evaluation. So you look up the diagnosis and all it says is CMC OA. Did anybody else audibly sigh? I have definitely been there. I have a love and hate relationship with CMC OA as a hand therapist and kind of treating it, and it can be definitely a challenging diagnosis. I think osteoarthritis in general can be a really challenging diagnosis to kind of work with patients in hand therapy and kind of manage expectations and also get like a really good result for patients too, and kind of getting back to a good quality of life. I think it can be definitely challenging. It's one of those diagnoses where I look back to kind of my initial days and my initial couple of years as a hand therapist, and just there's a couple patients in particular that I can like remember, and I just want to cringe with the way that I kind of went about treating them. Again, just the perfectionist in me, and just knowing that of course we are all going through those experiences. You all have to start somewhere. You learn more as you go along. So I just remember kind of not knowing what to do with these patients and not really having guidance and just feeling like I wasn't doing enough. And so that's kind of where this video is going. I want to talk a little bit about how I go through kind of an initial evaluation for a CMC OA patient. And certainly if you have other ideas or things that you think I missed, go ahead and leave them below. My goal for assessment is to figure out what the patient wants, right? Like we need to really focus on the patient. Yes, I do need to collect information so that I can guide the treatment plan, but I need to know what they expect. I need to know what their goals are. I need to know what they like to do, what they need to be able to do, what can they do and what can't they do. And what is their expectation of treatment? Are they somebody who's coming in and thinks that you're going to be able to completely take their pain away forever and cure them magically? Because that happens, right? Like those are people that literally come into your clinic. And so we have to figure out, okay, does this patient, just want to be able to kind of get back to their activities? I shouldn't say just, because that's a big deal. Are they having trouble with work things? Is there some kind of not motivation to go back to work because maybe they're not wanting to do the job that they do? Are they somebody who thinks that you're going to kind of fix them and they're kind of just handing their hand to you to fix it? Are they somebody that's really motivated? Do they want to avoid the surgery at all costs? Like where are they at kind of in their expectations, and where are they at in their understanding of their diagnosis and of this joint condition? So I think that that's a really big priority for an initial assessment. That's something that I definitely try to gauge from them too, and just listening to their story, those kinds of things I think are important. So with any assessment, I like to start off with a history. I want to know kind of about their symptoms. Again, when does it aggravate you? When does it feel good? Is this something that you've had a long time and just getting worse? Is it brand new? Was it caused, or kind of in line with an injury that happened to you, or just something that randomly came on? What is their perception of it? Do they feel like it's limiting them to participate in social activities or their meaningful occupations? Is it something that they just kind of power through it, or where are they at with that? So I think getting a good history is helpful for sure with all patients, of course. You want to kind of talk about pain too, right? And what their perception of pain is. Does it hurt all the time? Is it worse certain times of day? Is it more activities that are aggravating it? Are there things that aggravate it? And are there things that alleviate it, right? We want to know what the patient's doing and kind of put it back in their hands of saying, okay, you have this pain. What do you do about it? What kind of solutions have you tried? What works? What doesn't work? And trying to figure out kind of that route too. I always like to ask what the pain feels like too, right? The pain descriptor can tell you a lot. Is it sharp? Is it shooting? Is it burning, dull, achy, or throbbing, radiating? Like, what do they feel? And then kind of see if they can localize it, right? Ask them to point to the pain. Can they point to one spot? Does there multiple places? Is it something where they kind of like go across the entire arm? All those things will tell you something. Notice how they touch it too, right? Are they somebody who like will put pressure into it, or are they somebody who kind of doesn't even want to touch the skin? All those things are going to tell you something. So I think that's, kind of a good pain assessment, just going through, again, subjectively, what their perception is on that. I also will, of course, take goniometric measurements. I'll look at kind of the way that they're posturing themselves, the way that they move side to side, looking at their thumbs, are they somebody who has like a little thumb MP hyperextension? Do they have like hyperflexion of the DIP? Sorry, wow, I cannot talk. Time for another cup of coffee. Are they somebody who has hyper IP flexion when they're moving? Do they have, kind of movement of the whole CMC joint, or are they somebody that only does movement at the MCP joint? Taking a look at their wrist movement, their finger movement, and certainly comparing side to side, right? Goniometric measurements can help tell you a lot, but also observation, just looking at their movement patterns can tell you a lot. I also will like to do, grip and pinch strength if they'll tolerate it. Some people come into your clinic and they're in like a huge flare up, and then I might not test their pinch strength because you know what? It's probably just going to hurt them, and it's going to make them not trust me as a therapist. I know it's painful already. I don't necessarily need to measure their pinch strength on day one. I could assess that when the flare-ups calm down in a couple weeks if I need to. Because I think it's fair to say that when somebody's in a flare-up, they're going to have pretty bad pinch strength, and it may not be because of their pinch strength. It may be because of the pain. So I don't always test that. I do, I like to if I can, because again, it will tell me not only are they able to pinch and kind of control the movement, are they pinching with, again, the hyperextended thumb pattern and the unprotected position? Do they have hyperflexion of the IP joint when they pinch and put force? Does the MCP joint hyperextend? So I think it gives you a good idea of not only the number, but also the way that they're moving and kind of the way that they're putting force into the thumbs too, right? When they're going about their ADLs or their IADLs. So all those things are important. You can also do the paper rip test, which I learned about it a couple years ago, and then I kind of forgot about it conveniently for a couple of years. And just this past fall, in an educational session at the ASHT conference, actually in the fall of 2020, Judy Kolditz reminded me of it, and it's a really great test. You can definitely find it out there, a demonstration of it. But essentially you hand them a piece of paper, or like an index card would work really well. And you have them rip the index card several times until they can't rip it anymore. And as they're doing that, you take a look at what their thumb is doing, basically, and the mechanics behind their thumb position. So that's also a really good test. It'll tell you a lot about kind of them functioning in like a normal daily task. How does their thumb look? And then I touched on this a little bit at the beginning too, but I think, of course, any good assessment will kind of prioritize the goals of the patient, right? So you want to kind of go through like what activities are important to you, like what kinds of priorities do you have in your life, what types of things are you looking forward to getting back to or continuing, and what goals do you have, you know, not only with therapy, but also with kind of your life and kind of the next few years of your life. Like what kinds of things are you hoping to do? And so I think that that's something that, you know, you can kind of probe them about, and they'll probably tell you through the course of treatment too, right? It may be something where maybe on the first visit you ask them flat out, like, what goals do you have, you know, for your hands within the realm of therapy, and like what are you hoping to kind of get out of this brief course of treatment? And you can also ask them too, you know, kind of like what activities are really important to you, what things do you want to make sure you can keep doing for a long time. That way, you know, kind of where to guide your treatment and give you some ideas for how you can kind of best plan their care. So that's something that I also like to kind of focus on a little bit with that initial evaluation. And that's pretty much it. I think really, truly, when I'm assessing somebody for the first time, I think I'm definitely somebody who I believe assessment is an ongoing process, right? Every time you see a patient, you're doing some assessment. And I'm also somebody who, you know, in the kind of the way that the healthcare structure is limited, you only have a certain amount of time with somebody in each visit, right? So you don't have to collect every piece of information for your pretty paper on the first visit. If you don't have time to measure pinch strength, don't measure pinch strength. If you don't have time to do sensory testing, don't do it. If you feel like maybe assessing their fine motor coordination or their handwriting maybe is an important thing for them, or you want to have them do like a functional task so you can watch the way that their thumb works while they're doing that task, do it. You have to find like what you think is going to be important, and then realize that you may not have time to do all of it at one time. You may have to kind of assess continually over time too, right? And that's okay. You don't have to kind of get all of it done in one shot. So I think that's also helpful too. And yeah. Thank you guys for sticking around. If you made it to this point and you made it through all of that rambling with me, you are the true VIPs and the true MVPs. I hope you guys enjoyed this video. I hope it was helpful for you in some way or another. Again, if you have any questions, comments, if you think I left something out, if you want to, you know, kind of add to the discussion, please leave a comment below. I would super appreciate it, and I hope that I will hear from all of you soon. Thank you guys so much for watching this video, and I will see you in the next one where we will talk about CMC treatment ideas. Take care.